Good day, and welcome to the Integrated Planning and Monitoring, a Framework for Improving Practice conference call. Today's call is being recorded. At this time, I would like to turn the conference over to Chris King. Please go ahead.
Today, you'll be hearing from Greg Moore, Program Area Manager for Child Protection and In-Home Services with the Center for States, Dr. Michael Cole, Policy Fellow with Chapin Hall, Nicole Barnes, Constituency Services Manager with the Center for States, Sherry Levesque, Program Area Manager for Data and Continuous Quality Improvement with the Center for States, and Mona Davis, Region 6 Liaison with the Center for States. I will now turn it over to our facilitator for the day, Greg Moore. Thank you.
Thanks, Chris, and hello, everyone. Here you'll see our agenda for the day. After we walk through it, we'll do a quick review of our learning objectives. Then I'll provide a brief overview of the planning, monitoring, and reporting processes involved in child welfare. Then we will talk about this integrated framework for planning and monitoring for systems improvement, followed by a panel discussion, which you'll hear from the other four panelists regarding for preparing for, integrating, and the outcomes associated with integration and systems change. We'll then do a brief overview of some of the resources provided by the Center for States, and then at the end we will allow time for question and answer. Here you'll see our learning objectives. Today we will identify the importance of an integrated approach to systems improvement. We will identify strategies for aligning strategic planning and monitoring processes, such as the Child and Family Services Plans and Child and Family Services Review PIPs. We will identify strategies for incorporating continuous quality improvement principles into strategic planning to support readiness and data-driven improvement plans. And we will provide an opportunity for you to connect with your peers to discuss barriers and challenges and identify strategies and how you can coordinate practice improvement efforts. So with that, again, I would like to welcome everybody, and we will go ahead and get started. In their efforts to support and help to improve outcomes for children, youth, and families, it's critical that child welfare systems establish a clear vision for the future, like one that prioritizes prevention, with shared responsibilities across youth, families, and stakeholders. This can be more easily facilitated and better supported by integrating all pertinent improvement processes with continuous quality improvement, or CQI, principles and frameworks. Within child welfare, we are involved in a number of planning, monitoring, and reporting processes at the federal, state, and local levels, each with their own distinct timeframes, purposes, and teams, such as those listed here, including those that I mentioned earlier, the CFSP, the CFSR PIP, agency CQI processes. These are complex and often time-consuming initiatives. They are essential to agency operations and, in some cases, the funding at the state and federal level, and they can easily become overwhelming. Integrating federally mandated strategic planning and program improvement processes like the CFSP and the PIP with CQI efforts can help states align priorities, make connections between processes, share information among teams, and realize efficiencies. Throughout our conversation today, we hope to offer some ideas about what actions agencies can take to improve the alignment and connections of all of these potentially competing priorities to improve efficiency and ultimately improve outcomes for the children, youth, and families involved in their systems. All right, now we would like to take an opportunity to hear from you all. We'll take a few minutes. If you would, please respond to the polling questions here. You'll see that on the left-hand side of your screen, check the planning, monitoring, and reporting processes with which you have experience. The second question on the right-hand side of your screen, in your experience, how challenging is it to integrate all of these processes effectively? So it looks like folks, a number of people have experience with the CFSP, the APSR, the Child and Family Services Reviews, as well as the Program Improvement Plans, agency CQI processes, as well as state and local initiatives and other federal processes. And then there we're seeing that many of us find that it is between somewhat and very challenging to effectively integrate these processes. I'll allow a couple more minutes. Thanks so much for your contributions here. Again, just keeping an eye to things. It looks like that a lot of the experience is consistent with those initial numbers that I said. So with that, again, thanks so much. It's important to hear from you all to get a perspective of where you're at. But with that, we will go ahead and move forward. The Children's Bureau's requirements for strategic planning, monitoring, and reporting, such as those listed here, help states define a vision and set goals to promote the safety, permanency, and well-being of children and families. They also ensure compliance with federal funding requirements. States also work to improve child and family outcomes and agency functioning via state-initiated continuous quality improvement efforts and other change initiatives, as we just saw from the previous survey. While each of these processes has a specific purpose, they should work together to outline how states' systems are functioning and help states create and implement comprehensive, targeted, and sustainable long-term plans for improvement. These are ongoing processes representing continuous cycles of review, assessment, revision, and implementation. So in other words, they represent key aspects of a functional and effective strategic planning process. So that begs the question, what is strategic planning? Strategic planning, as in the CFSP, is a continuous process that aims to improve an agency's performance and takes a long-term view of the direction in which the organization would like to go. It involves evaluating an agency's current status and developing and implementing strategies and approaches that will allow the organization to move towards its goals. Coordinating strategic planning efforts across child welfare monitoring and reporting processes gives jurisdictions a broader and more far-reaching vision of their system functioning and needs, allowing them to monitor systems and interventions, create more targeted plans for improvement, adjust their plans with the backing of comprehensive data and evidence, and to report more efficiently. In a key change to the previous Child and Family Services Plan, the Children's Bureau structured the further integration of the CFSP and APSRs with the CFSR statewide assessment and requires states to assess their performance on the CFSR's 7 outcomes and 7 systemic factors as part of their CFSP and APSRs. This change was made to better coordinate and integrate these processes into cohesive and ongoing system improvement efforts and to emphasize that they are meant to work together as a part of a comprehensive and coordinated strategic plan. To provide guidance on how state and federal partners can work together to integrate the goals and objectives of these processes, the Children's Bureau developed a guide for implementing improvement through the CFSP and CFSR, the phases of which are outlined here. The first phase focuses on identifying a planning and implementation team, developing a communication plan, and analyzing relevant data to pinpoint what strategic goals the team will focus on. The second phase helps ensure the proper supports are in place, designs monitoring and feedback loops, and plans for implementation. The third phase here involves 2 key components: the actual implementation of the interventions and the measuring the quality and outcomes of implementation efforts and making any needed adjustments, including addressing long-term sustainability. Teams involved in these processes should look for ways to incorporate sound CQI and change management strategies into their work. And again, strategic planning must begin with the team establishing a clear, shared vision of where they want to go and what they hope to achieve. Strategic planning sets a vision that guides an agency's steps towards achieving its established goals. An ongoing process of review, assessment, and planning helps agencies identify problem areas and promotes continuous improvement so that agencies can reach their goals. By applying CQI principles and strategies to their planning and quality assurance, states can help ensure that their processes are better coordinated to accurately address current needs and find the best and most relevant ways to move toward goals over time. The objective of CQI is to help teams assess their organization's status and readiness for change and guide them in plotting the best strategies to address challenges and achieve sustainable change. As illustrated here, the CQI process helps agencies identify and assess needs and opportunities, develop a theory of change, select and adapt or design interventions, plan, prepare, and implement, and evaluate and apply findings. As jurisdictions consider their 2020 through 24 Child and Family Services Plan and future strategic plans, agencies should reflect on the CQI practices and strategies they have in place and consider whether they have been effective and how and where they can be improved or updated. The Center for States has developed the brief Strategic Planning in Child Welfare, Integrated Efforts for System Improvement to support jurisdictions in aligning the many planning and reporting requirements. The visual on the screen is from the brief and captures the cycle of ongoing improvement efforts and reporting mechanisms and the timeframes in which they typically occur. The task listed here and in the brief can help agencies align planning, monitoring, and reporting processes to establish an integrated approach to systems improvement. It's important to note that different jurisdictions will be at different stages and should start wherever is most appropriate based on where they are with their system improvement efforts and the federal processes. At the same time, agencies need to focus on what they have to complete to meet federal requirements and to inform their programmatic decision-making. This is particularly relevant now as you all and other states and territories are working on the 5-year Child and Family Services Plan, which is due June 30th. This does not need to be a replacement for what jurisdictions are already doing, but rather a guide to support action where needed. Let's briefly walk through each of the steps. An integrated approach to improvement requires a unified planning structure comprised of planning and implementation teams and subgroups as needed, with clear governance and responsibilities. The agency's leadership should lead the planning processes and exercise ultimate decision-making authority, but a more diverse collection of stakeholders and key stakeholders should steer the system's strategic planning and reform efforts. Agencies should consider what teams they already have in place and, when necessary, establish planning and implementation teams that include a core steering group responsible for coordinating and aligning planning and improvement processes, as well as a teaming structure that supports engagement of youth, parents, families, and key stakeholder groups, including representatives from various levels and jurisdictions of the child welfare system, tribal partners, the legal and judicial communities, related state agencies, and additional key stakeholders and partners. Having a core team of individuals responsible for coordinating and aligning all planning and improvement processes can help ensure effective integration. Agency leadership, in partnership with the team members, should regularly review the team's composition to ensure that the necessary partners are represented throughout these processes, such as the CFSP and the CFSR and PIP development. It is especially important that agencies engage in a joint planning process with the Children's Bureau Regional Office before beginning the alignment of these federal processes. This work should be a partnership between the jurisdiction and the Children's Bureau. The CFSP, APSR, and CFSR all include an assessment of or update on the child welfare system's performance on the child and family outcomes and systemic factors. We are not going to talk much today about the specific instructions in the program instructions that were released last week for the 2020 through 24 Child and Family Services Plan. But here, when we talk about assessments of performance, the corresponding section from the current PIs is the assessment of current performance and improving outcomes. Coordinated planning and monitoring require integration of the performance assessments used in all of these different processes. Jurisdictions should use a systematic approach rooted in data to assess the system's performance, be it for the CFSP, the subsequent annual progress and services reports, or other related processes. It's important to note that before beginning the integration of performance assessments, the state should have already engaged in a joint planning process with the Children's Bureau Regional Office regarding this work. The planning and implementation team should assimilate the available data and evidence to accurately evaluate the system's performance on key measures, such as those child and family outcomes and systemic factors that we've referenced, as well as important state-specific metrics. For each updated assessment, such as in an APSR, the team should create a comprehensive data plan that includes all pertinent internal and external data sources, then collect and analyze the information. The team will draw conclusions based on the analyses, prioritize the findings, and establish the specific problems to be addressed. Planning and implementation team members will then take a deeper dive to identify possible contributing factors and explore and validate potential root causes before finally isolating the root causes to address through the change effort. In updating each performance assessment, the planning and implementation team will reflect on the previous assessment to monitor progress, map trends, and identify gaps. Integrating these assessments will provide a consistent measuring rod against which the state and territory may evaluate its performance. So here, aligning plans for improvements. From the Round 3 CFSR PIP to the 2020 through 24 CFSP, child welfare agencies develop plans for improvement in response to findings from performance assessments and monitoring processes. Again, referencing the recent PIs, here when we talk about a plan for improvement, the corresponding plan would be plan for enacting the state's vision. Specifically, teams review assessment information and prioritize the outcomes based on needs, strengths, and resources. Using an integrated approach to improvement, the planning and implementation team should establish goals, objectives, strategies, interventions, and action steps for implementation that align across planning and improvement processes. They will outline measurement plans, identifying performance indicators, measures, and benchmarks, as well as roles and responsibilities, and timeframes and timelines in establishing the plans for improvement. As teams plan changes to address problems and needs, they should consider developing a theory of change to map the pathways they want to take from an identified problem to a desired solution or outcome. Before a jurisdiction selects the reform initiatives and interventions it wants to implement as part of the improvement processes, such as the CFSP or a PIP, the planning and implementation team should develop a comprehensive understanding of the populations whose outcomes it wishes to change, including their characteristics and needs. The state or territory should then use this information to inform the selection of the most appropriate interventions that are likely to improve the identified outcomes for the target populations. Rather than approaching each of these plans for improvement as separate processes or mandates, states and territories should coordinate these efforts by integrating the plan's goals and implementation. The planning and implementation team must determine and clearly articulate the overarching goals of the change effort, like the CFSP or the PIP, based on the changes the jurisdiction hopes to achieve by the end of the improvement period. The goals should align with the state's prioritized needs, respond to improvement efforts mandated by federal regulations, and reflect the input of key internal and external partners, notably youth and families and other key stakeholders. States, territories, and local jurisdictions, such as counties, parishes, etc., should assess their readiness for implementing specific interventions before beginning implementation. This is critical. Having been in a state agency on an executive staff, I can speak to the importance here of this assessing readiness. It's a key step. It allows jurisdictions to identify the infrastructure, development, and technical assistance required for implementation. After developing objectives and selecting specific interventions to meet the needs and challenges and achieve the plan's goals, the planning and implementation team should establish an implementation plan. This involves documenting the identified goals, the target populations, objectives, selected interventions, and core components. The planning and implementation team can use the results of the readiness assessment to develop an implementation plan for the new solution they're putting in place. For example, agencies might document the specific actions to be taken for each intervention, including actions needed to put the necessary supports, such as infrastructure in place, the required timeframes, and the sequencing of key actions. As much as possible, the implementation plans for these improvement processes should be aligned to avoid redundancies and to line up implementation supports with monitoring and evaluation plans. Existing CQI practices can be used in conjunction with monitoring and reporting processes to evaluate implementation, and agencies should not expect to align these processes all at once, but should do so as much as they can at every phase of the work. Agencies can work with the Children's Bureau to determine how the CFSR outcomes can be used to inform strategic planning work. Once finalized, the planning and implementation team should implement and manage the plan in coordination with all other planning and improvement processes, including communicating the plan to stakeholders and supervising implementation. The team will assess progress and improvements at regular intervals and adjust as needed, including scaling up and sustaining interventions when appropriate. Once the plans for improvement are implemented, jurisdictions will assess improvements and outcomes to determine whether the interventions are having the desired effect and adjust as necessary, addressing potential concerns with specific interventions and/or their implementation. Jurisdictions should use these evaluations to determine when specific interventions are ready for expansion. The planning and implementation team should analyze data and evidence related to initial implementation efforts to determine whether interventions are ready for expansion based upon the criteria established in the implementation plan, considering information received through feedback loops and the process, fidelity, and outcome measures. The team should take a holistic approach to these evaluations, regularly assessing the impact of all system improvement efforts and the interventions and solutions from each plan for improvement. This coordinated approach will help states and territories ensure that they are making improvements in all required areas and working toward improved safety, permanency, and well-being outcomes for children, youth, and families. As jurisdictions determine that specific interventions are ready for expansion, they should assess and adjust the implementation plans as needed, determining whether the rollout, schedule, sequencing, and the like are still appropriate based on the data and evidence from the feedback loops and the process, fidelity, and outcome measures. States and territories should establish and put into operation plans and mechanisms to sustain the improvement efforts after the completion of the plans for improvement, such as the PIP and the CFSP. After achieving the outlined goals and objectives in these processes, jurisdictions should look to other areas needing improvement and repeat these processes to implement improvements and affect change. All right, at this time, I think y'all have heard enough from me, so we want to hear from you again before we jump into our panel. And at this time, if you would, there are 2 more questions here for you. What is the biggest challenge you currently face in being able to align these reporting and monitoring processes? And what, if any, successes have you had in trying to align these efforts? And so these are short answer questions. Give folks a couple of minutes to respond. Staff resources, absolutely, there we go again. Limited resources, too many expectations. Timing, yes, time and timing. Staffing, limited resources. Duplication. Integration can help with duplication. Actually, integration can help with all these, but definitely. So lack of leadership buy-in, absolutely. So yeah, so we're seeing here that from many of you, there are common themes here, and these are obviously things that many of us experience. When looking over here at the successes that folks have had in aligning these efforts, inclusion of the program improvement plan in the CFSP. I would say fiscal year 2018 CFSR state. Thanks for sharing that. Thanks to everybody for sharing. Align various plans for years now. Yeah, I know that many jurisdictions have been working on this. Great collaboration with the CIP. Hey, that's fantastic. All right. Well, so looking at this, again, thanks to all of you for sharing. This is useful information, I think, too, again, like you're hearing from us, you've heard from me, we've heard from you. We are now going to be able to move into a panel discussion to hear some other real-world examples that will hopefully help to bring some of this to life. So at this time, I don't want anybody to be alarmed. You are now going to see myself and the other panelists. We are going to be appearing by a webcam at the top. Our panelists here, you're going to hear from Dr. Michael Cole, Nicole Barnes, Sherry Levesque, and Mona Davis. Mike Cole and Mrs. Barnes will present examples from outside of child welfare, but from related and pertinent systems to child welfare to show how other systems have approached this work, while Mrs. Levesque and Mrs. Davis will share de-identified jurisdictional examples from child welfare. For the first part of this discussion, our panelists will talk about what some systems have done and are doing to prepare for large scale change and integration. And so at this time, I'd like to turn it over to you, Mike, to get us started.
Yeah, hi, thanks. I was going to just for a minute talk about, I'm going to give examples from healthcare and talk about why I would be someone who would give examples about healthcare and why I'm on this call. I've spent the bulk of my career at Vanderbilt University in an academic medical center setting, working largely in children's behavioral health and working in programs that partnered with our child welfare system in Tennessee. Vanderbilt's a large academic health center in Middle Tennessee. But also during that time, got to do some work in our quality and patient safety shop. And quality and patient safety in all health systems, but certainly in large academic health systems like Vanderbilt, is where the work of driving quality improvement work, helping align with the strategic goals of the medical center of the university, and helping sort of shepherd the system through Joint Commission reviews. And I would say that I believe there's a lot of similarities between healthcare with respect to how they approach quality improvement and deal with some of these issues, and child welfare. There's a lot of important differences, but I think there are some important similarities. I think there's a lot to be learned across the two systems. I think there's a real parallel to be drawn between, of course, we all deal with a lot of external partners who help us get better and improve, but there's a lot of parallels to be drawn between the Joint Commission and its function as an arm of the Center for Medicare and Medicaid, and the CFSR reviews and how that works, and how hospitals develop responses to their reviews, and how we all work with our PIPs and our systems and work on those to get better, and how we want to step back and align those strategically with the goals of the broader institution. Where they differ significantly, I think, is that Joint Commission is a semi-governmental organization that sort of functions both as something like COA or CARF, if any of you are in accredited organizations, in that they're accrediting hospitals. But hospitals have to have this accreditation if they're going to bill for services to Medicare or Medicaid, and virtually every hospital in the country does. So they're effectively the accountability arm of Medicare and Medicaid. And as the biggest payer in the system, not by virtue of explicit federal policy, but just by virtue of being the biggest payer in the system, they drive a lot of policy change in hospitals through Joint Commission accreditation, through that process of sort of helping systems get better, holding them accountable, helping them work through their version of the PIP when they have a review. In a big system like Vanderbilt, you're sort of aligning around big system change frequently, but doing it within the confines of sort of one building, effectively, one big hospital system, bunch of buildings, but it's one leadership structure, one quality improvement shop. We did a lot of this. We did a lot of big system change initiatives. We would try to, I would say sort of an important lesson to learn is we would try to focus on just a couple of things at a time and laser focus on them. We also used a set of tools that sort of help us align. I noticed in some of the responses to that last question that Greg put up, some of the common things that create problems for our quality improvement work. And I would say that in all systems, this is across systems, not just child welfare or human services or healthcare, the majority of quality improvement projects don't get the ultimate intended outcome. We struggle to take a project all the way through to success and have it really get the outcomes that we thought it was going to get when we drew it up, for all kinds of reasons. But the really obvious identifiable ones that you can also go to the literature and find support for are some of the things that you guys were putting up, things like leadership buy-in or engaged leadership, having a budget, having the resources, having time, having staff dedicated. So we actually created out of our quality shop that we began using on all of our quality improvement projects what we call the project bundle, but it was just a simple tool that helped us score where we were with respect to all those important things that we knew the literature predicted, or we knew from the literature could predict success or failure of a quality improvement project. So we would use it to gauge when we thought we were ready to go start a big system improvement change. So if we continued to get together and work on this project and we knew, sort of based on our scoring and comparing it to other projects, that we simply didn't have engagement yet at a leadership level on this important project, around surgical site infections, for example. We would continue delaying and working on engaging leadership until we felt like we were ready to go act. So as I turn it over now to let Nicole talk to you a little bit, I'm going to come back after we do a couple of examples from, I think, child welfare and some other settings, and I'm going to give you one big system change initiative that we lined it up in that way that I just described and had a lot of success in the Vanderbilt system. And it's a really simple and straightforward quality improvement project around hand hygiene, which is an important patient safety issue in all hospitals. So Nicole, I'll turn it over.
Great, thanks, Mike. I appreciate for all those wonderful examples from the healthcare industry. Today, I have the honor of representing the Eastern Iowa, Western Illinois Trauma-Informed Care Consortium, who I had the pleasure of working with for 4 years prior to coming to the center. The TIC Consortium was really born out of a recognition from community child welfare service providers of the need to develop a community-based approach to increase awareness of ACEs, or adverse childhood experiences, and integrate trauma-informed care practices in their community. They had a real clear vision that trauma-informed care work really belonged to the community and not really any one group or collective of agencies. And so they had to really strategize around how to bring all of the different silos of human care services in a community together. So early on, the group leads realized they needed to agree on a theory of change as kind of their guidepost, their roadmap for all of their decisions to come. And that theory of change really had to be broad enough to allow them to progress their mission and values in alignment with SAMHSA TIC principles, but not micromanage all of the partner agencies and the service providers that they were trying to engage in this effort. But this theory of change really helped them to stay true to their course, especially when all of these different partners have different responsibilities. You know, for example, corrections, their first priority is community safety. The domestic violence organizations, their first priority is to the survivor. Teachers, their first priority is to educate. So they began with a collaboration between 3 key community service providers, and they started researching the trauma-informed care work in other areas, other communities. They conducted a community needs assessment, which involved a series of focus groups with a lot of different service providers, some community partners, and then they had key stakeholders, including parent and survivor groups. And all of these groups continue to be engaged and consulted in the development of all of their community education materials as they move forward. So the team developed a framework for kicking off the consortium that brought together all of these community stakeholders and a number of others from many different fields, including the school systems. They had early childhood representatives there. They had child abuse prevention, other child welfare service providers. They had behavioral health professionals and other related community service providers, such as folks that worked in pantries, community pantries. They also had university partners as well as folks from the criminal justice system. And the goal of this initial kickoff stakeholder meeting was really to inform the community and then really collectively come together and strategize around how they could begin to develop some sub-teams to begin doing this work. And then taking that and building some action plans and some strategies to help engage other community members on how to address the overarching concerns. The TIC team really recognized early on that provider community needed to understand and learn about trauma-informed care and ACEs before they could begin educating families on a broad basis. They really wanted to be sure that providers were ready to deliver best practice interventions, so the community education piece really became a primary focus early on. So I'm going to come back and talk a little bit later about some of the challenges that they engaged in doing the work and then some of the successes that they've had. But I want to turn it over to Sherry and Mona to talk a little bit about how this applies specifically to our work in child welfare.
Thanks, Nicole. And now thinking about this in a child welfare context, you know, Mona and I both come from working at the management level in child welfare agencies, and when I remember that and think about that experience and think about doing this kind of a large-scale system change effort, it can be a little bit overwhelming. There's always so many things going on at any given time in a child welfare agency, lots of different initiatives and priorities, and it can be really hard to tie them all together in one cohesive plan. And as a result, I think agencies often approach the CFSP, for example, more as a compliance requirement than as a comprehensive strategic plan for their agency, and might assign someone to lead it or to write it who might not always be connected to or in the loop about other planning efforts or CQI efforts happening in the agency. So sometimes I've seen this can result in sort of plan overload for the agency, if you will, a plan here, a plan there, a plan there, and different people leading them, but not necessarily a clear vision for how they all fit together. And I'm wondering, Mona, if you've experienced that as well?
I have seen that, but I've seen a lot of great ways that states have addressed that too. One state, for example, used the CFSP development process. They performed an assessment of readiness by taking a comprehensive inventory of all their active interventions, their projects, their strategies, and then connected them to specific goals, objectives, and desired outcomes. This helps give the team an overall picture of all the ongoing CQI efforts and a better understanding of the team's duplicated efforts, redundancies, gaps, as well as giving them an initial idea of what data and steps were needed to move forward. This first step gave that team a foundation upon which it could build a change management plan to help them inform how they needed to move forward to developing their CFSP.
Wow, Mona, that's a really great example of preparation for developing a plan like the CFSP that doesn't reinvent the wheel, but starts where things are already at. You know, it makes me think about another aspect of preparation for developing a plan like that I've seen. I think a lot of states may want to involve a larger group of staff or stakeholders in that kind of a discussion, but sometimes it's hard to bring all the different roles of people together that you might want to because of the time that's involved in trying to get them up to speed on what's happening and what the context is and all of the other information that they might need to know to be able to participate in that conversation meaningfully. Sometimes just orienting people to the many acronyms we use to describe different plans and initiatives can take time just by itself.
I know it's hard to get everyone on the same page to start. I know a couple of states, though, that they decided to develop a 20 to 30-minute audio recording that gave an overview of their child welfare system that included goals for safety, permanency, and well-being. It included the definition of the acronyms, the descriptions of federal reporting requirements for, you know, a Child and Family Services review, the Child and Family Services plan, an annual progress report, etc., and a few others, just real high-level overview of all those processes. And then they posted it online. Then when they sent announcements or they were inviting stakeholders to be a part of a planning meeting or even joining other types of groups, they would share this link in the invite and ask them to listen to this as a part of orientation to the work that they were going to embark on. This was not only helpful of having this available on the public website for anyone who was interested or even on the site, but also helped engage and prepare stakeholders for any work that they were participating in. So, Greg, I think I'll turn it back to you.
Thanks, Mona, and thanks, team. Those were great examples. And honestly, like, I've been working with you all and putting this together, but I'm excited to get into the next section just to hear the subsequent examples. So without further ado, let's do that. Folks, now y'all are going to hear from our panelists about examples of systems actually doing the work of integration and systems change, including what might be some common challenges in large-scale systems change and integration and what strategies were used or could be used to overcome them. So to hear about some examples from the healthcare industry, as he teased in his last comments, I'll now turn it back over to Mike to kick things off.
Yeah, thanks, Greg. Yeah, so I was going to give a really specific example of what was a really large system-wide quality improvement project that was both strategically aligned and very much aligned with what our external partners, CMS and the Joint Commission, were driving us towards. So it turns out that if you wash your hands, you get fewer infections. Big secret in hospitals. It also, unfortunately, turns out not all physicians and nurses wash their hands. So hand hygiene is a big emphasis for most health systems and certainly a big emphasis for the Joint Commission. And what's gone on in hospitals over the last 10 to 15 years is they've really aligned this idea of quality and patient safety. And with CMS's help, as I said, as the big payer in the room, they've leveraged, for example, taking money back from hospitals when they have readmissions or surgical site infections or some of these other bad outcomes that we don't want to see in hospitals. When they did that, it was much easier to align at the system level because it got the chief financial officer at the table. And in most sort of modern forward-thinking health systems, it took their quality improvement leader, and many of them started creating what was called a chief quality officer role. So put that chief quality officer at the table with the CFO and the CMO and all the other O's in the C-suite. That was really important for aligning the work of improving the system with, all the other goals of keeping the lights on and, building new buildings and all the other things that health systems do. So with respect to hand washing, CMS had already had us doing some very specific things that we were able to leverage. They actually do, by way of the Joint Commission reviews, hand hygiene audits. So as part of your Joint Commission reviews, you're doing like secret shopper-like audits where you're watching for opportunities for people to wash their hands on the unit. You go into units that aren't yours and checking whether or not they did and creating sort of that observed to expected ratio. We thought they would wash their hands and they did or didn't. And that would be a measure of hand washing compliance. What we also knew we had to do, and kind of going back to some of that earlier discussion about what are the important things you have to have in place when you're doing your readiness assessment, one of the big things that we often overlook is the culture. And you've probably seen or heard some version of this quote, strategy eats culture for lunch. I'm sure you've all had the experience of drawing up the perfect quality improvement initiative and then introducing it to the world and having it fail because it ran up against a culture that wasn't prepared to introduce it. So we knew there was a significant cultural component to something as simple as driving hand hygiene compliance, because what we knew was that if a physician walked into a room and the care partner or the environmental specialist or the nurse that was in the room said, Dr. Moore, I noticed you didn't wash your hands. There's a foam in station. The sink's over here. Is there anything I can get you? If Dr. Moore turns to that nurse or care partner or technician and says anything other than thank you, if Dr. Moore turns and says, I know well when I need to wash my hands, he's created a disturbance in the force, and we've put that nurse or care partner out there at risk of challenging somebody, another professional, who has this perceived power differential. So it's a real big culture component that we need to address. We need to set the culture in such a way that people felt safe speaking up and challenging one of their colleagues when they weren't doing what we expected them to be doing. And that meant that when Dr. Moore turned and said something other than thank you, there had to be a huge system sort of backing up that process so we could hold Dr. Moore accountable. So what seems like a very simple quality improvement project, like let's put signage up, let's put foaming stations everywhere, let's encourage people to wash their hands, let's watch them wash their hands, and then let's give them every opportunity to wash their hands. Actually, it's way more complicated than that, because if you're going to hold one another accountable in that context, you have to consider culture, and culture oftentimes is the thing that submarines what was an otherwise well-designed quality improvement project. So again, we built an accountability model. We built a very structured process for when we noticed that either compliance wasn't where it needed to be, or that we were getting a reaction from folks that was something other than thank you. We built a process for engaging and escalating accountability. And drove like 90% compliance hand hygiene rates and sustained them over a long period of time, and had had associated decreases in infection rates across all of our critical care units in the hospital. So it was now written about and really effective quality improvement project. It took actually a lot of thought to solve a very simple problem, and it took a recognition that we needed to address culture as we address this problem or this improvement opportunity in our system. So I'm going to come back in a second and I'll give another example that actually crosses over from child welfare to healthcare. It draws on both. It was I left Vanderbilt for a period of time and worked in our child welfare system in Tennessee and had the opportunity to work on a big system-wide quality improvement project that sort of crossed over. So with that, I'm going to turn it back over to Nicole to touch base again about the TIC teams.
Yeah, thanks, Mike. That'll make you want to wash your hands, though, that story, right? So the consortium team, they faced many of the same challenges that our child welfare system partners have faced in integrating their planning and change efforts, including getting community services team members to commit time and resources to the effort. They had challenges motivating some silos within the community to participate in a comprehensive community-based effort where they didn't always understand the clear connection to the work that they were doing. It took a lot of outreach and networking, building of relationships and building of trust with these community partners. And as community organizations began listening to the work of the team, there were other questions that kind of bubbled up about, okay, I'm learning about what ACEs do. How do I apply this knowledge to changing practice? And at the time, there really were not a lot of concrete answers around this, and the answers really varied a lot depending on the area of the work the organization was in. For example, trauma-informed practices in a mental health setting will likely be very different than the ones that are needed in a school-based setting or hospital or even a criminal justice system. They also had similar funding challenges. Their initial grant was really only for a 3-year period, and so there were definitely concerns about sustainability early on. There were limited resources to explore other funding opportunities, so they had to be very conscientious about how to use the resources they had while they continued to engage potential future funders and made progress really just one small grant at a time. All of these challenges required that the team really work strategically to align plans between their key stakeholders in the effort as well as other community members, and to coordinate those efforts to develop sustainability planning, to continue to work on their core mission of improving the use of trauma-informed practice in different areas of human services as well. They developed and delivered training materials that were in line with national approaches on understanding ACEs and how to address them from a collective community standpoint. And then they also coordinated with other statewide advocates to ensure that they had a common language and a shared understanding of ACEs awareness and trauma-informed practice approaches. They applied for grant funding when possible, and they really partnered with local organizations to guide them to a clear understanding of what they could do with ACEs and trauma-informed care practice information to change practice in a variety of different settings. So I'll come back to that story at the end of our time today, but I'm going to turn it over to Sherry and Mona for a few more examples from child welfare.
Thanks, Nicole. That really brought out a lot of good examples about bringing together a diverse group of stakeholders to work on a shared plan, which is really the example I have in the child welfare setting. I have one example from a state that developed a standing child and family or child and services planning committee. It was established under the director's office, and they would convene at least quarterly and serve as a committee that would review data trends, offer insights to barriers, assist in informing the annual progress and services report, serve as one level of the state's feedback loop in their CQI structure, and also be available as needed for other types of information or access that the agency needed. For example, this committee was involved in the statewide assessment process and the CFSR, and then would even sometimes target systemic factors and other items to have discussions and feedback on how the state was performing. This membership was really diverse too. It was a big team that had a diverse membership. It included staff from all levels of the agency, both director level, regional director, caseworkers, supervisors. It included representatives from private providers, placement providers, a mental health practitioner representative was on it, representatives from the court. They actually had a judge and a parent attorney, including a child's attorney. They had state tribal representatives on it. They had an older youth from their youth advisory group and a foster parent from their foster parent association representative on it also. And then in addition, they invited their community-based providers that focused on primary prevention to the table. So.
Yeah, you know, Mona, that's a great example, and I'm so glad to hear it because it's a way to kind of avoid a trap that often happens that I've seen. Lots of times child welfare agencies will try to solve all the challenges on their own because that's what we do, right? We're problem solvers. But that's just an uphill battle. Lots of times plans like the CFSPs and the PIPs are written by somebody at the management level of an agency, and then other managers and leaders review the plan. And field staff, parents and youth or stakeholders aren't necessarily involved in putting it together. And then you can have this situation where very smart people have worked really hard for many months putting this plan together, but it's almost destined to fail if it's missing critical perspectives or only relying on the agency's resources to be able to carry it out. I think another thing I like about that example is that the committee was ongoing and met continuously throughout the year because, as we said before, and as a lot of people mentioned in the poll, because child welfare agencies juggle so many priorities all the time, they often start focusing on the CFSP or APSR at a specific point in time during the year, typically around maybe February or March. The person in charge of it sends out an email telling everyone it's that time again, and then everyone scrambles around for several months to pull it together for submission in June. And it seems like in order to be really a data-driven and meaningful plan, the plan would be happening continuously throughout the year. But it can be really hard to figure out how to do that without adding to people's plates that are already pretty full.
I know, and I've experienced that same challenge. I have seen some success in a couple of states where the challenge was really how to operationalize that child and family services plan in a way that the field leadership understood their role and responsibility to the plan. Like you said, a lot of people, you do the plan, it sits on a shelf, and no one really always knows even what's in the plan. So the lead for the federal reporting provided an orientation of the intent and purpose of the Child and Family Services Plan and the APSRs, those Annual Progress and Service System Reports, and with the approval of the director, revised the director's monthly report that was provided by the regional managers to include elements of information that could really specifically inform the Child and Family Services Plan or an Annual Progress and Services Report. For example, the report already contained information about the trends on performance of each area and how they were addressing those issues. So another section was included to describe the specific barriers related to workforce, service array, community engagement, and just other elements so that the director's team at the state level could better understand those barriers and help develop solutions at the system level. Then this expanded actually in a way that the information was available to various CQI feedback loops for other programs and other program managers to better understand the needs of children and families at that field level. Also, during regional state meetings, this gave the director and program staff an opportunity to provide updates to the regional directors and had facilitated discussions on trends across regions so that they could have further conversations to problem solve these barriers as a broader group. Sometimes there was targeted training that could be developed and provided based on the information that was collected through those monthly reports, or maybe just at one of those meetings there was clarity, or they provided information on how to be how to develop a more consistent practice around supervision. Then during the federal reporting time, the lead would include how the field was not only implementing that strategic plan, but how they were tracking and monitoring and engaging with communities and addressing a lot of those challenges and barriers at the system level as well as the field level. I think we have time. I have another example related to something that another state is doing pretty consistently to make sure that they're continually looking at their data to make sure that it is effective or to know what's working or not working. One state has made it a practice to regularly crosswalk their CFSR data with its current CFSP. The teams regularly communicate and share data about what is happening in the field and how it is connected to the state's strategic plan. They are able to make well-informed changes to the plan when necessary and have more specific information and are better able to explain why changes were needed with the backing of some of that solid data points. Continuously sharing and connecting the data among processes can really help states more accurately align their strategic plans and aim for more targeted long-term improvements. That's just a couple of examples that I've seen in states. And so, Greg, I think I'll turn it back to you.
Great, thanks for that. Wow, good stuff, Gil. I appreciate the sharing so far. And again, because this is going so well and wanting our audience to be able to hear the next piece, I'm going to go ahead and move us straight into that. So now that we've talked about examples of preparations for alignment and the work of integration and systems change, we should dig in a bit to the outcomes of these efforts. So for the third and final part of the group discussion today, we'll hear from our panelists on what outcomes can be realized when silos of work and improvement processes are aligned, including goals and early indicators that will lead to improved long-term outcomes. And so, Mike, I'm excited to have you begin this last piece of the discussion.
So I'm going to talk about a project that came out of our systems analysis or our child death and near-death review work that we do at Tennessee. We have about 5-6 years ago started borrowing from healthcare and this patient safety approach in hospitals to apply kind of a human factors and systems approach to our child fatality and near fatality reviews and to much of the other work that we were doing. It came from this sort of simple premise that like surgeons and pilots and engineers in nuclear power plants, all these other so-called safety critical industries, our child welfare professionals also make these high-risk, high-consequence decisions all day long, and so might they benefit from some of these same strategies. So we literally kind of took the process for doing what hospitals and Joint Commission used to call root cause analysis, but they've shifted to calling it, I think, root cause analysis 2, trying to get away from a language that implies there's any one root cause to a problem in a sort of complicated systems like child welfare. And we started applying it to our child death reviews. And one of the first findings that resulted in sort of a successful quality improvement project, and all of you quality improvement professionals, I'm sure know that quality improvement 101, when you have something you've done and had success, celebrate it because it gives you momentum for that next quality improvement project. So one of the first things we identified that we spent a lot of time talking about still was that our number one preventable cause of death in our child welfare system was sleep related. They were those safe sleep deaths that were occurring in our child welfare system or around it. So families that we were engaged with, either prevention services or they had been involved in our system at one time, or they were currently in the system. And at the time, we had no real recognition of that. We hadn't trained our workers. We didn't have a policy for it. And the state, it happened, was also doing work. We were able to align that work with both some of the children's hospitals we did work with and with the State Department of Health. We interacted around our child death reviews, the Department of Health reviews, and our reviews inside the system, so it gave us a nice point of articulation. And they were already out ahead of us in thinking about this as a statewide public health issue. So our work got to be a sort of a priority for them. It helped us align. It helped us pull in additional stakeholders and resources. But then we went about the work of, again, kind of assessing our readiness and determining whether or not we were going to be able to pull this off. Because what we determined through our systems review, this kind of new approach to thinking about problems in our system, was that the problem wasn't one of not having a policy or not having staff trained. Those two things were important, and we did them. The problems were systemic. They were problems like myths that you weren't allowed to stockpile a pack and play in one of our county offices, that if I submit a request to buy a pack and play because I've recognized that a kid doesn't have a safe place to sleep, fiscal's just going to deny it anyway, so why should I do it? Or it'll take 2 or 3 weeks, so I'll just go do something different. So we had to work through all those systems problems. We had to align our system. We had to bring fiscal to the table. We had to bring regional leadership to the table. We went about a process of trying to set what other safety critical industries call a zero goal, which is, and sometimes zero goals can be good and sometimes they can be harmful. If you drive past a construction site and you see a sign that says 300 days since we've had an accident, they've set a zero goal. They've said we don't want to have any accidents. They've probably created a disincentive for reporting accidents, which is dangerous on construction sites. By contrast, in intensive care units and hospitals, when you set a zero goal for ventilator-associated pneumonias, that's an objective thing that they can count, and they put together bundles of activities that they do every single time, and they're really successful at driving out infection. So we set that kind of zero goal, and we said, we're not going to leave a home until every kid in the home, every infant, has a safe place to sleep. So it's a zero goal. And we had to back up from that. And it's really similar to what every children's hospital now or hospital in the country would never let a kid, an infant, leave the hospital without a car seat, right? So we just knew that if we were going to do that, we had to back up and figure out a way to get pack and plays out into the field, get them replenished, build a process. Again, a very simple sort of problem with a really complicated fix that had, a lot of these important barriers that we discussed earlier. So we went about that work. We brought in our partners. We partnered with some of the children's hospitals in the state to help us with training. We got some materials from the State Department of Health. They helped us with some of the technical stuff and the writing of our policies, got all of our child welfare professionals trained, figured out a process for pack and plays. And I would say now that you're always anxious about talking about these kinds of outcomes. Child deaths of all kinds are fortunately rare events in our systems. We don't actually have a lot of child deaths inside child welfare systems. And as I said, the most frequently occurring and preventable one was these sleep-related deaths. But consistent with trends that are going on statewide, even outside of child welfare, we've seen sleep-related deaths go down in Tennessee consistently rather from 16, 17, and 18. There were actually 23 fewer deaths in 2018 than there were when we sort of started tracking and doing the work in 2016. So big system-wide project. We brought in a lot of stakeholders and, knock on wood. And again, these are the kind of outcomes you're always anxious about talking about because it's hard to know if it was really causal or if there's some secular trend going on in the state that's contributing. But even if awareness sort of writ large is one of the outcomes, that's a good outcome. So that would be an example of a big system improvement project that we went about. It took a lot of alignment, a lot of integration, and it feels like we're seeing some positive outcomes that are really important big outcomes. So I think this time I'm going to turn it over to Sherry and Mona for some more examples.
Right, thanks. And that is a great example of a prevention effort that was successful because systems were able to align, right? And in the child welfare world, I do have one state example that was in response to recent approval of the Families First Prevention Act. I think it's an example of good teaming leading to agile decision-making and targeted action. As you know, the act, or may not know, but the act was passed in 2018, and it restructured the way specific federal child welfare funds can be spent by states. So as soon as the legislation came out, the state's management team prioritized exploring what overarching immediate action steps would need to be taken to ensure that the state was compliant. The state had submitted a written state assessment as well as completed its CFSR, and we're actually expecting to report back as their final results of the CFSR back from the federal team just any day. As they pulled together this team and really began to look at the Families First Prevention Act, they realized that as they thought about it, that there were several strategies that would be the same strategies that they would think about implementing to improve their CFSR results. So they decided to include them in their PIP as well, so to make sure that they were integrating and aligning. The teams anticipated that there would be action steps related to new legislation. They were able to work flexibly to identify the overarching compliance concerns and related issues that would need to be addressed and could be addressed in their program improvement plan. I don't know, Sherry, do you have any comments or?
Yeah, I was just thinking that that's a great example of tying two plans together, but it's also a great example of breaking things that are really large down into smaller chunks. So sometimes developing a plan for something like Family First or the CFSP in the way that you would want to, in a way that engages stakeholders and is data-driven, it can seem so big, like such a big undertaking, that if the agency can't get all of the pieces in place to start with, then sometimes they don't get started. And then the processes end up happening in the same way that they maybe have always happened because it needs to get finished, right? And so I like the example of starting with the things that were sort of low-hanging fruit or immediate things that, you know, could happen more quickly and getting moving.
Yeah, I like to think about it as, you know, one small step leads to another small step, leads to another small step. That leads to increased understanding and integration and system change. The challenge, I think, is identifying where it is occurring in your system and leveraging it in a way that moves the state forward, and then articulating it or reflecting or documenting this as a part of the work that the state is doing. I think about it like one state was able to access their Family Leadership Committee to request a parent to participate during the development phase of practice guides for direct service workers. This provided the opportunity to have parent voice and lens in the creation of a practice guide that would be used by caseworkers who were working directly with families. One judge brought together a local team to discuss timely permanency in his jurisdiction. One community group asked the state director for data trends for their community so that they can start making some decisions about informal services or supports that they would like to offer to families in their community. One parent partner coordinator takes the lead in facilitating a local focus group of parents that have been involved in the child welfare system to offer suggestions and ideas to a committee that parent partner coordinator serves on at the state level on the child, you know, on a child welfare committee. So I just think it's small steps that together can really build and lead to system change. I think I'm going to turn it over to Nicole for her final, see what happens with this committee that she's got.
Thanks, Mona, and I totally agree. It's that taking one small step at a time and building on it over time. You know, I'd like to close out in talking about the Eastern Iowa, Western Illinois Trauma-Informed Care Consortium and their ongoing work. It's the work that they've been doing has led to a core steering committee, and they've also been able to secure more long-term funding for dedicated staff to the project. You know, over the last 6 years of work, they have delivered training and support to more than 5,000 community members on ACEs awareness and trauma-informed practices in school systems, in behavioral and mental health systems, in juvenile and criminal justice systems, as well as early childhood systems and many others. Their efforts have led to a range of training and development materials and resources that really support different silos of human services work. And the team really has a core group of everyday champions who are passionate about the movement, and they've integrated the framework into their own systems to impact their specific community that they specialize in. The ongoing community-based efforts have really led to increased collaborative strategic planning and community partnerships between providers that really hadn't traditionally partnered together. There have been groups of agencies that have partnered to apply for and share grant opportunities, and community funders are coming together to support larger scale outcomes, including requiring a demonstration of trauma-informed care principles, or at least an understanding of them in order to access certain buckets of funding. There have been integrated programs and practices that have been developed by partner providers didn't really exist prior to this work. There have been the development and implementation of mental health and drug courts, and there's one special program that's a partnership between the local school systems and the police departments that allow the police department to notify schools when children have been involved in a trauma-informed or trauma experience, just so that the school system is aware that there may be some changes in that child's behavior and some rationale behind it. There are some agencies that are even partnering to dedicate a trauma-informed staff and to share them and embed them in different settings to really ensure that trauma-informed practice is consistently integrated into a variety of different settings in the community. So really kind of it comes down to the more people in the community who learn about and begin to operate from a trauma-sensitive approach in their everyday work, and the more organizations and agencies who understand trauma-informed practice needs specific to their area of work really help to improve and increase the outcomes that they've achieved. Just some examples of some of the things that have come out of the work that they've done is that they really have a number of entire school districts that have committed to trauma-informed principles and implementing practices that really align with their culture and resources. They have supported over $90,000 worth of teacher grants to purchase trauma-informed classroom resources. They have introduced trauma-informed training into justice-involved patient worlds by providing training to first responders and police departments in a multi-county area. There's several agencies that have all of their staff now completing the trauma-focused CBT class online. Some have overhauled their treatment planning models to include trauma-informed principles. They're writing trauma-informed care practices into job descriptions. There have been grants that have funded over 20 therapists to receive EMDR training, which is eye movement desensitization and reprocessing. They speak with business leaders regularly, including the Chamber of Commerce, to continue conversations around mental health and trauma-informed workplace practice. And they encourage governance boards to fund for long-term outcomes and connect everything back to their original theory of change and integrating their short-term outcomes into their annual strategic planning cycles. So they've really taken the next step, and they see lots of work in their future as well. So I know I'm going to turn it back over to Greg to close this out today.
Thanks so much, Nicole, and honestly, thanks to you, Mike, and you, Sherry, and you, Mona, as well, for your contributions today, and for our participants. I hope that as we are talking about the integration of strategic planning and monitoring and reporting processes, that these examples have helped to bring the content to life. So, and I hope that it has resonated with you all that it's not about accomplishing everything at once, that, really it is one small step after another, as multiple panelists said. With that, Chris, if I could have you switch back to our other layout for me. Thank you, sir. So beyond this webinar, the Center for States has other resources that can help you with this work. Specifically, you see here a couple of screenshots. The Center's Change and Implementation and Practice Series webpage and the new Strategic Planning and Child Welfare Series webpage are both resources where you can find more information on strategies to explore problems and needs, develop strategies to make changes and implement them effectively, as well as align these activities with your overall approach to strategic planning, monitoring, and reporting. Additionally, the Center has a number of other products, resources, and supports which may be of use to jurisdictions when working to improve specific areas of practice and working to improve safety, permanency, and well-being outcomes. The Center can provide customized technical assistance to your state or territory to promote jurisdictional capacity building, such as around strategic and long-term planning, like for the current 2020 through 2024 Child and Family Services Plans, which we all know is due June 30th. So If you would, please let us know how we may be of assistance to you and your colleagues in this work. And so at this time, as we start to close out, we want to hear from you all in a polling question, and then we're going to open it up briefly for some questions and answers from you all. So here, what additional information or resources might help your jurisdiction begin or build up integration of monitoring and reporting processes? This is another short answer, so I'll wait and let folks type in. But here, we are recognizing that this work is not easy, and again, you heard from all of us here today that with some of our experiences with it and the challenges that come with that, but that there are certainly ways to overcome those challenges and barriers. And so here, we're interested in what, if any, additional information or resources might help you or folks in your jurisdiction. So I think we with the Children's Bureau's current the vision and priorities, we're in a great place, I think, in child welfare. Reorienting toward prevention, still focused on safety, permanency, and well-being, and the center definitely has a lot of existing resources that, as I mentioned on the previous slide, that can help you all. And so here, again, just seeing what are some other specific examples of things that might be useful to you in doing this work. Make a recommendation of who, speaking about position types, should be on a core strategic plan development team, number of persons recommended for this team. The examples today were helpful. Hey, glad to hear that. And I will get that first one. I'm going to come back to that. Examples of evaluation plans used to monitor initiatives. That's great. Might be helpful to have a repository of projects that other states have been successful in implementing and the processes they used. If I'm working on a placement stability, it'd be nice to see what other states have done to be successful. While we heard some good examples today, it'd be helpful to see the concrete examples. What did it actually look like in the PIP or the CFSP? Good point. And so thinking about some of this as just as people are continuing to type, I'm thinking about folks who are looking here for specific examples of what's going on in other states. That's things that we can explore as a center to be able to put information out. We have a number of constituency groups and communities of practice here within the Center for States that are position and subject specific. So, for example, I work with a constituency group for state liaison officers, for hotline intake and screening managers, for Children's Justice Act grantees, as well as for in-home services managers, and another group for promoting safe and stable family managers. We have a group that Sherry works with and Nicole helps with that is specific to the Round 3 CFSR program improvement planning. And so there's just a number of constituency groups and communities of practice that are currently available, and we're always keeping our ear to the ground and listening to you all as our customers and constituents to see what additional groups could be useful, as well as what additional types of events like this could be useful. And so, and I think that the question about what would make up a good planning and implementation team. At this time, I'm going to go ahead and, Chris, if you'll take us back to the PowerPoint layout, I'm going to move us into our question and answer session, and I'm going to put some of our panelists on the spot with that. And so without calling anyone out explicitly, and I'm happy to answer this too, but I wonder if any of our panelists would like to weigh in on the types of folks who you think would be best served to be on a planning and implementation team, that core steering committee for some of this strategic planning work.
Yeah, Greg, this is Sherry. I have some immediate thoughts about that, but I also want to refer people to our teaming brief, because I know there's some specific information in there about, there's a really good example of a kind of a core team and sub-teams like we described in this event today. There's a really good example laid out in there, including some, suggestions around the right numbers of people for each of those types of teams. But as we mentioned today, I think it's important on the core steering group to have representation from not only decision makers, but folks who are doing the work that you're trying to target and folks who are impacted by the work that you're trying to target, just sort of as a general rule. So in child welfare, that would typically be parents and youth, that would be frontline staff, that would be certainly program management, and then certainly external stakeholders that play key roles in what you're trying to target. So for example, if permanency and improvements to that are part of what you're trying to target, then certainly court and legal representation would be critical to that.
Thanks, Sherry, and great tie to the teaming brief. It is a part of that change in implementation and practice series that we mentioned just a moment ago. I'd also refer you all to the second brief in this strategic planning series, which has to do with meaningfully engaging stakeholders to improve outcomes. We talk about some of that in there as well, specific to strategic planning and with references to the Child and Family Services plans. So I want to make sure that we allow for answering any other questions that you all may have. So if folks have additional questions, please feel free to type those into the participant chat now. I'll also, at this time, since I'm not currently seeing any pending questions, I will open up the floor if there are any other things that any of my other panelists would like to contribute or add, or ideas, contributions you have.
So
I
Greg
just
is
would reiterate, Greg. Oh, go ahead, Sherry.
Sorry. I was just going to say that, in response to one person's or a couple people's comments actually in the poll about it would be helpful to have a sense of what other jurisdictions, are doing in regards to certain common types of challenges, and particularly in their PIPs. I'll just mention it. I'll just elaborate on something you mentioned, which is that we have a constituency group that's been meeting fairly regularly, and we have another event coming up in April, and we're working actually right now through a series of events sort of exactly for that purpose. So for example, the April event that is coming up is focused on family engagement strategies in PIPs. And the sort of the idea of the event is to give folks working in states an opportunity to talk to one another about what kinds of challenges, but even more particularly what kinds of strategies they are developing or have developed for their PIPs, for instance, and also looking now towards their CFSPs, how that will integrate into that. So that's an opportunity potentially to hear that kind of conversation and to share as well with others. So look, the announcement for that will be coming out in a couple of weeks if people want to keep their eyes open for that.
Thanks so much, Sherry. It's great information, and there's a lot of great work going on in that group related to the program improvement plans, and certainly the ties to the CFSP are very relevant now as folks are working on those. So at this time, we are coming to the end, and Kim, I see your question there, and I think that this R3 PIP COP would potentially be a great resource for you. And so, again, here as we start to end the webinar, I just want to thank all of you for your participation today. We've provided the center's contact information on the screen in case any of this, if there's any follow-up you have, if there's referrals that we can make for you or get you in touch with the right groups or resources, we definitely want to help with that. Please make sure to complete the evaluation survey to let us know what you thought of the event. You will see it now at the top under the box that says we'd love to hear your feedback. And so with that, again, thank you to my panelists and thank you to all of you, and have a great afternoon.
We are at the end of our scheduled time, so we will be finishing this webinar shortly. Feel free to contact us using our website, capacity.childwelfare.gov/states. That's capacity.childwelfare.gov/states. You can also contact us by our email address, capacityinfo@icf.com. That's capacityin@icf.com, or by our phone number, 844-222-0272. Thank you for joining us, and have a great day.